So we have this great term, alternative medicine, that's been around forever, and it used to mean things that were done over here. We might go over here and have acupuncture, but it didn't have anything to do with our conventional medicine. But that terminology is even changing because we don't do alternative medicine very often. What we're seeing a lot more is this integrative medicine. So we know there's evidence that acupuncture can help, for example, my headache. Maybe I'll use my pill, I'll use my acupuncture, the best of conventional. So actually we're even moving beyond alternative medicine into this terminology, integrative medicine. But most people, most consumers, we're still looking for information on alternative medicine. So that's why we still talk about alternative medicine, so we can make sure and reach people with that kind of information. So at Mayo, we have this great value: the needs of the patient come first. And if we can meet that need with something that's already sitting on our shelf, so much the better. But a lot of times we can't. Patients might have chronic pain or some other condition that conventional medicine doesn't have the answer for. Arthritis, fatigue, sometimes sleep problems. So it's great to be able to reach into this other side and say, what over here might work? And so we've done lots of research to evaluate, could acupuncture be helpful? Could massage be helpful? Could meditation be helpful? Not to replace conventional medicine, but once we know they work, to bring them right alongside and use them together. Well, so patients are asking about almost everything you can think of. Clearly dietary supplements, always very hot. I think there's this hope that there's a magic bullet. If I just take the right supplement, I get this antioxidant, it's going to take care of all my problems. And I think we should approach supplements and herbs the same way we approach pills. If they're strong enough to help us, they're probably strong enough to hurt us. So we have to treat them with respect. Let's balance what we know about dietary supplements. Some can be used very effectively, and certainly things like fish oil have become very common as part of conventional medicine. Vitamin D, we're starting to see a lot more vitamin D deficiency than we ever anticipated. That was sort of popular in the alternative realm for many years. Now conventional doctors are starting to recognize there's a lot of truth there. So we know that probably 50 to 60% of Americans are using something that might be considered alternative medicine. And we also know a lot of them are getting their information from not very reliable sources. And we've seen people harmed by purchasing things they shouldn't have, taking things they shouldn't have. So our mission is to make sure our patients get the best information they can. We want consumers to have access to that same information. Time is a great partner in that they have this great reach, they have these great writers. We were able to provide the expertise to make sure that what's coming out together reaches those people with useful information that helps them make informed decisions about how to take care of their health. So it's a kind of an interesting book. It's got lots of different segments, a couple sections kind of talking about maybe massage is kind of the focus, or some of the hands-on therapies. Another section focuses a little more on dietary supplements, cleanses, things that are kind of in the news. As you go through the whole book, you get this nice update on what's going on in this realm. Where's the research going, and how do we use this information to help keep ourselves healthier? So there's a couple things that people come, I think, with misconceptions, and one is that kind of concept that natural is equated with safe. And you know, hemlock is natural, not very safe. Tobacco is natural, we don't think of that as very safe. So there's that one part or approach there. People are maybe a little too quick to get excited about the labeling. On the other hand, we also have the reverse. We have people who are pushing back. Oh, I'm not sure about that. Well, that comes from the East. I don't know if I can trust that. Or maybe that meditation is contravening my religious beliefs. And so I think we sometimes have to work both angles. We don't want people to miss opportunities with things that might be very helpful, like meditation, because of misperceptions. Vice versa, we don't want people to adopt things too quickly. We really want to have this idea of a partnership. What if I could work with my doctor, and he and I, or she and I, could work and sit down together and look at this? Could meditation help my blood pressure? Is this dietary supplement safe? And if we have that kind of dialogue, I think we're going to start to see more and more of this emphasis on health. Can we promote health, as opposed to here's my symptom or here's my problem, how do I fix it now that I'm broken? This is sort of I think in many regards, self-care. If you learn meditation, it's something you're doing for yourself. And that's kind of fun, because a lot of these things in this realm are things you do for yourself that I as a physician don't have to prescribe, or I can't do for you or to you. So this idea of self-care, promoting health and wellness, this is where it starts to get fun in this realm of alternative medicine merging into the concept of integrative medicine.